Well, arthritis, back pain, even migraines are just a few examples of chronic pain. It's when you feel pain off and on. And in fact, about a third of Americans are affected at a cost of $600 billion a year. So how do you treat it? And could one solution lie in the way you think? Here to explain that is Dr. Eric Swanholm. He's a psychologist with Baylor Scott and White. Good morning to you.
Good morning.
So let's first talk chronic pain. Where can people feel this pain, and where's the worst?
Well, I mean, people can experience it, pretty much anywhere. The definition being, pain that persists beyond, 3 to 6 months beyond when an injury is expected to heal. But typically, low back pain, that's the most common, neck pain, but there are also autoimmune diseases that, can fall under the purview of that as well.
What are some of the most common ways to treat it?
Typically, opioid medications, painkillers, a lot of people using Tylenol, ibuprofen as well. But,
keep going. I was going to say, but you're telling me, though, there is a way to actually bring your mental state into the picture and help ease some of this pain, in addition to the medication that you might already be taking.
Absolutely. Well, an important consideration here is that nowadays, research has been finding that treating the whole person, meaning the psychological aspects, the other life stressors, as well as, the medical difficulties, is most effective. So where I come in is that I help people learn how to cope with things like depression, anxiety, and how they may be sort of contributing to pain, and also stress. So non-medication, without using opioids.
So there's a name for it. It's called behavioral medicine training. And so how does this play out, and how many sessions, and how long does it take?
Well, a typical course of it is about 8 sessions. It includes individual type of therapy, but it includes things like relaxation training, helping people learn to develop better sleep habits, stress management. But the most important thing is that this type of therapy involves working with other types of professionals. So oftentimes coordinating with physical therapy, pain management MDs, of course. At Baylor Scott and White, that's something that we're really, offering, which is very helpful to a lot of patients.
Yeah, kind of looking at the whole picture.
Absolutely.
Well, thank you so much for coming in this morning. We are already out of time, but we're going to have more information about this on our website at kxan.com a little bit later this morning for you. We'll be right back after this break.